Operating under the prestigious title of healthcare, big pharmaceutical companies collectively create one of the largest and most profitable institutions in the world. The industry as a whole reaches annual sales of $149.3 billion. Pfizer, a top competitor, claims to be dedicated to applying science and our global resources to improve health and well-being at every stage of life, formulating the original purpose of the institution around manufacturing innovative medicine to prevent and treat illness in humans. In order for innovation to exist, there must be incentive from competition. The top 10 big pharmaceutical companies make up 81.6% of the total industry, with the four largest companies responsible for 43.9% of it. As long as companies maintain their large stake in the industry, it would appear that there is little incentive for innovation. Adding to this issue, big pharmaceuticals have increased their acquisitions of smaller companies. Smaller competitors such as Schering-Plough, Weth, and Genentech have been bought up by Pfizer, Merck, and Roche. This is referred to in the industry as mega mergers. At which point do these mega mergers cross the line of a monopoly? Pfizer has recently confirmed a mega merger with Allergan, the largest revenue stakeholder in the generic industry. The combination will form the world's biggest drug company with projected annual sales of $65 billion. With more than 50% of current industry annual revenue, Pfizer would obtain more than half the buying power of the market and the ability to control the production of brand name and generic drugs. All of this power may easily lead to market manipulation. Recently, brand name pharmaceuticals have been suffering revenue loss due to patent cliffs, with the creation of new blockbuster drugs costing upwards of $1.5 billion, including potential risks of failure. Companies are redistributing their revenue. Research and development methods, once used to develop trademark drugs, are conforming to a new option of producing drugs with an assured return. Billions of taxpayer dollars have gone to the creation of innovative drugs in terms of molecular entities. At best, these excuses for new drugs provide minor clinical advantages compared to other drugs in similar categories. These FDA laws, once designed to protect the moral creation of innovative drugs, have become malleable in the hands of big pharmaceuticals due to their lobbyists. FDA law reform included application fees, priority applications, shortened deadlines, and the Prescription Drug User Fee Act. All of these led to the FDA approving drugs without doing a thorough investigation in order to meet deadlines, allowing big pharmaceuticals to produce drugs with little to no added benefits. This is not the only manipulation of the FDA. The United States is the largest consumer of prescription drugs, and it seems to be in direct correlation with the US and New Zealand being the only two countries who allow direct-to-consumer advertising. Direct-to-consumer advertising, originally instated to provide the public with valuable drug information, would soon be abused as a marketing scheme. By 2000, Merck was spending more money advertising to its soon-to-be defunct painkiller Vioxx than Budweiser, Pepsi, and Nike. Vioxx sales for the year topped $1.5 billion. How much influence does big pharmaceuticals truly have on drug sales? You should ask your doctor. Above all, the key selling point for a successful medication is achieving the trust and approval of the doctors. This practice is expensive and time-consuming, requiring countless drug reps to travel from office to office, sweet-talking physicians over lunch and small gifts. New England Medical Journal conducted a national survey investigating financial ties between physicians and the drug industry. In the survey of 3,181 physicians, researchers found 94% of physicians reported some type of relationship with the pharmaceutical industry. 83% of the relationships involved receiving food in the workplace. 78% received drug samples. More than one-third of the respondents received reimbursements for costs associated with professional meetings or continuing medical education. 28% received payments for consulting, giving lectures, or enrolling patients in trials. These gifts are just a way to get in the door. The real purpose of those meetings is to get the trial journals into the hands of the physicians so they can see all the remarkable progress. The journals are secretly a marketing vessel for an unnoticeable delivery of falsified information. Companies have the ability to design their experiments, which allows them to reshape the trials to get desired results. These trials are refined to fit market profiles. Then they hire publication teams, editors, statisticians, and writers to craft journal articles favorable to the sponsor's drug. Did we expect too much from an institution given great moral responsibility to provide the public with healthcare services? With the highest profit margins in manufacturing, is it too tempting to think for personal interest? The once moral institution of Big Pharma has been corrupted by the Americanized corporate greed.